Assalamualaikum warahmatullahi wabarakatuh. Hello friends, how are you today? I hope you are always healthy and always happy. Don't know then love. Introduce myself. My name is Alifa Mutia Pancalani and my friend.
Hello everyone, my name is Dian Nisrina and my student ID number 55.
My name is Destika Sayani, my student ID number 013.
My name is Safa Oktasa Sabila, student ID number 021.
My name is Laili Santi and my student ID number 221105000016.
Hi, my name is Anissa Putra Nuraini. My study ID number 2211050049.
Hello, let me introduce myself. My name is Nelly Mukaroma and my student ID number is 2211050050.
Hi friends, let me introduce myself. My name is Yumna Meanaditya. You can call me Yumna. My study number 009.
My name is Nasusama Salsabila, my ID card number 2211050017.
Here we will to explain about the illness and condition. Let's start the presentation.
Obsessive-compulsive disorder or OCD. Obsessive-compulsive disorder is a mental health condition in which a person has obsessive thought and compulsive activities. An obsession is an unwanted and unpleasant thought, image, or art that rapidly enters a person's mind, causing feelings or exactly disgust or discomfort. What causes OCD? In some cases, the condition can run in family and may be linked to certain inherited genes that affect brain development. Compulsion are repetitive behavior or mental action that a person feels they need to perform to try to temporarily relieve the unpleasant feelings caused by obsessive thought. Septic shock. Septic shock is a life-threatening condition that happens when your blood pressure drops to a dangerously low level after an equation. Symptoms of septic shock: 1. Low blood pressure. 2. A change in your mental state. 3. Diarrhea. And 4. Nausea and vomiting, cold, clammy, and foul skin. 13. Septic shock: 1. Oxygen therapy. 2. Medication. 3. Antibiotic. And 4. Surgically.
Neuroendocrine tumors are tumors that can occur in the cell of the neuroendocrine system. The symptoms of neuroendocrine tumors can vary depending on where it is and what hormones it produces. Diagnosing of neuroendocrine tumors: 1. Blood test. 2. Urine test. 3. Scan. And 4. Biopsy. Treating neuroendocrine tumors: surgically remove the tumors. The first tumor is type kidney cancer in children. The symptoms of Wilms tumor: 1. Swollen abdomen. 2. Fever. 3. Blood in urine. And 4. Blood pressure. Treatment of Wilms tumor. Treatment for Wilms tumor: 1. Chemotherapy and 2. Radiotherapy. 1. Chemotherapy. In the use anti-cancer drugs to destroy cancer cell. Radiotherapy treats cancer by using high energy rays to destroy the cancer cell.
And our next topic is Panic disorder. A panic attack occurs when your body experiences a rush of intense psychological and physical symptoms. You may experience an overwhelming sense of fear, apprehension, and anxiety. An attack won't cause you any physical harm, and it's unlikely that you will be admitted to the hospital if you have had a panic attack. What causes panic disorder? As with many mental health conditions, the exact cause of the panic disorder isn't fully understood. However, it's thought that condition is probably linked to a combination of physical and psychological factors. To diagnose panic disorder, see your doctor if you have symptoms of anxiety or panic disorder. Treating panic disorder. The aim of treating panic disorder is to reduce the number of panic attacks you have and ease the severity of your symptoms. Psychological therapy and medication are two main types of treatment for panic disorder. And our next topic is rheumatoid arthritis. Rheumatoid arthritis is a long-term condition that causes pain, swelling, and stiffness in the joint. When to seek medical advice, you should see your GP if you think you have symptoms of rheumatoid arthritis, so your GP can try to identify the underlying cause. What causes rheumatoid arthritis? Rheumatoid arthritis is an autoimmune disease. This means that your immune system, which actually fights infection, attacks the cells that line your joints by mistake, making them swollen, stiff, and painful. Who is affected? Rheumatoid arthritis affects around 400,000 people in UK. And what is possible complication? Having rheumatoid arthritis can lead to several other conditions that may cause additional symptoms. What is possible complication? Having rheumatoid arthritis can lead to several other conditions that may cause additional symptoms and can sometimes be life-threatening.
And now we're gonna talk about vulva cancer. Cancer of the vulva is a rare type of cancer that affects women and anyone with a vulva. The vulva is a woman's external genitals. It includes the lip surrounding the vagina, the clitoris, and the Bartholin glands. Most of those affected by vulva cancer is older women and anyone with a vulva over the age of 65. Speak to your partner if you notice any changes in the usual appearance of your vulva. While it's highly unlikely to be the result of cancer, this change should be investigated. You may be able to reduce your risk of vulva cancer by stopping smoking and taking steps to reduce the chances of picking up an HPV infection. And did you know how vulva cancer is treated? The main treatment for vulva cancer is surgery to remove the cancerous tissue from the vulva and any lymph nodes containing cancerous cells. Some people may also have radiotherapy or chemotherapy or both. And can vulva cancer be prevented? Yes, the HPV vaccination may also reduce your chances of developing vulva cancer. And the next topic is yellow fever. Yellow fever is a serious viral infection that is spread by certain types of mosquito. It's mainly found in sub-Saharan Africa, South America, and parts of the Caribbean. If you are planning to visit places where yellow fever infection is found, you should seek travel health advice before you travel. A map and list of countries where yellow fever is found is available on the NHS Fit for Travel website. How yellow fever is spread? The virus that causes yellow fever is passed to humans through the bites of infection mosquitoes. Yellow fever symptoms. Yellow fever symptoms occur in two stages. The initial symptoms develop 3 to 6 days after infection, and it can include yellow fever vaccination. The yellow fever vaccine protects you from the infection when you travel a country where yellow fever virus occurs and prevent the disease from spreading between countries.
Urinary incontinence. Urinary incontinence is the unidirectional passing of urine. Signs and symptoms: stress incontinence, arch incontinence, urinary incontinence, pregnancy and vaginal birth, obesity, a family history of incontinence, increased age, although incontinence is not an inevitable part of aging. How urinary incontinence is treated: lifestyle change, pelvic floor exercise, bladder training. Preventing urinary incontinence: controlling your weight, avoiding or cutting down on alcohol, keeping fit, in particular, ensuring that your pelvic floor muscles are strong, trying to keep your pelvic floor muscles strong. Thrush. Thrush is usually caused by Aedes fungicial Candida albicans. This is commonly known as thrush infection, or Candida. These are useful if you are sure you have thrush and want to treat it yourself. If thrush is not treated, it eventually goes away on its own. There's no need for your partner to have treatment unless they have signs and symptoms of thrush. You may be given antifungal cream to apply to the genital area. Vaginal pressures oral is a combination of treatments. Avoiding thrush. Some people find that different triggers cause vaginal thrush. Make sure vagina is well lubricated before and during sexual intercourse. Regular thrush. Some people may only get thrush once. If you get recurrent thrush, the doctor or nurse will want to check the other conditions, such as diabetes and the big. Pressure ulcers. Pressure ulcers are an injury that breaks down the skin and underlying tissue. How pressure ulcers develop? Pressure ulcers can develop. How pressure ulcers develop? Pressure ulcers can develop when a large amount of pressure is applied to an area skin over a short period of time. Who is affected? It's estimated that just under 500,000 people in the UK will develop at least one pressure ulcer in any given year. Treating and preventing pressure ulcers, therefore, a range of techniques is used to prevent them developing in the first place. These include regularly changing a person's position, using equipment to protect vulnerable parts of the body, such as specially designed mattresses and cushions. Septic shock is a life-threatening condition that happens when your blood pressure drops to a dangerously low level after an infection. Symptoms of septic shock: 1. Low blood pressure. 2. A change in your mental state. 3. Diarrhea. 4. Nausea and vomiting, cold, clammy, and pale skin. Treating septic shock: 1. Oxygen therapy. 2. Medication. 3. Antibiotic. 4. Surgery.
Psychosis, non-average risk of suicide. It's estimated 1 in 5 people with psychosis will attempt to commit suicide at some point in their life, and 1 in 25 people with psychosis will kill themselves. Side effect can also occur if someone is taking in antipsychotics on a long-term basis. Word is a common side effect. In rare cases, a person with psychosis may also develop type 2 diabetes. Otitis externa is often referred to as swimmer's ear. There are a number of different types of ear drop that might be used to treat otitis externa, but they are them
to be used several times a day for about a week. Your GIPS might refer you to a specialist for further treatment and advice if symptoms are severe often they fail to respond of treatment. Ulcerative colitis. About ulcerative colitis is a long-term condition where the colon and rectum become inflamed. What causes ulcerative colitis? Ulcerative colitis is thought to be an autoimmune condition. This means the immune system, the body defense against infection, goes wrong and attack healthy tissues. The most popular theory is that the immune system mistakes harmless bacteria inside the colon for a threat and attack the tissue of the colon, causing it to become inflamed. Varicose eczema. Varicose eczema is a long-term skin condition that affects the lower leg and is common in people with variant face. Symptoms: itchy, red and swollen, dry and flaky, slightly or crusty. That cause varicose eczema. Varicose eczema is caused by increased pressure in the leg vein. Varicose eczema is caused by increased pressure in the leg vein. How varicose eczema is treated? Self-help measures, emotional, topical corticosteroid, compression socks.
Cancer of the vulva. Cancer of the vulva is a rare type of cancer that affects women and anyone with a vulva. The vulva is a woman's external genitals. It includes the lips surrounding the vagina, labia minora, and labia majora. The clitoris, sexual organ that helps reach sexual climax, and the Bartholin's glands, two small glands each side of the vagina. Most of those affected by vulval cancer are older women and anyone with vulva over the age of 65. The condition is rare in a woman and anyone with a vulva under 50 who have not yet gone through the menopause. Symptoms of vulva cancer can include a persistent itch in the vulva, pain, soreness, or tenderness in the vulva, rash and thickened patch of skin that can be red, white, or dark, a lump or wart-like growth on the vulva, bleeding from the vulva or blue-stained vaginal discharge between periods, an open sore in the vulva, a burning pain when passing urine, a mole on the vulva that changes shape or color. The exact cause of vulva cancer is unclear, but your risk of developing the condition is increased by the following factors: increased age, vulva intraepithelial neoplasia, where the cells in the vulva are abnormal and at risk of turning cancerous, recent infection with current version of human papillomavirus, skin condition affecting the vulva, such as lesion sclerosis, and smoking. How vulva cancer is treated? The main treatment of vulva cancer is surgery to remove the cancerous tissue or from the vulva and any lymph nodes containing cancerous cells. Can vulva cancer be prevented? It's not thought to be possible to prevent vulva cancer completely, but you might be able to reduce your risk by practicing safe sex, using a condom during sex, can offer some protection against attending cervical screening appointment. Cervical screening can detect HPV and precancerous conditions such as VIN. Stop smoking. Thank you for the presentation. Do you understand what the illness and condition? And now for the next session is question and answer. Before you are asking, please raise your hand. We have finished our group presentation this time, just like you and him who finished without never starting. That's all for me. Wassalamualaikum warahmatullahi wabarakatuh.